welcome to Helios Skin, Hair and Laser Clinic. Sports and skin, that is our topic. We have Dr. Shraddha.
Athletes can face increased sweating, sunlight problems because of inappropriate clothing or the fabric.
Hello and welcome to Helios Skin, Hair and Lasers YouTube. Today India is absolutely proud with its achievement in the Asian Games. We have 107 medals, the highest achieved so far. We're doing well in the other sports as well, and it's certainly delightful that India is setting its footprints across the globe where sports is concerned. Now you're wondering, what is Helios doing with sports? Well, sports and skin. That is our topic for today's episode. Skin plays a very important role because it acts as a protective cover for our body. And why should a sportsman ignore that particular organ? So I have with me today Dr. Shraddha, who's going to be sharing insightful inputs about how even an athlete or a sports personnel can and should take care of their skin. Hello Doctor.
Hi.
Once again, welcome to yet another episode on skincare, and this time we're talking about sports. So first, to begin with, there's so many athletes, and today India is doing so well in sports. But I don't know how much athletes take care of their skin. So is it really important for athletes to take care of their skin?
Yes, definitely it is very important because athletes can face a lot of problems due to increased sweating, and also if they're into outdoor sports, sunlight problems. So the problems that can come because of excess sweating is, one, if they are acne prone or if they have dandruff, then it can worsen because of excess sweating. And sometimes there's something called as sweat dermatitis, where the skin becomes red and rough and irritated because of inappropriate clothing or the fabric, which can press against the sweat and it stays in the skin and irritates the skin. Then they can have what we call as prickly heat. The ducts are basically the sweat openings are blocked by the sweat debris. So that can cause what we call as malaria rubra, and then infections, which is very common because it's called athlete's foot because of it's seen quite frequently in athletes. There's scaling and maceration of the skin in the web spaces, which leads to infection. Fungal infections can occur anywhere in the folds specifically, and you have bacterial infections like folliculitis, hair follicle infections. Then warts, because the skin is moist because of sweating, especially the feet, they're prone to get viral infections, and if there's an interchange of footwear or anything like that, that can cause warts. So commonly this is what they're likely to face because of sweating. Then because of sunlight, whatever happens, tanning, what we call as polymorphic light eruption, sunlight induced rashes, then they can have sunburns, and worsening of any pre-existing diseases can get flared up if with sun exposure, excessive sun exposure.
I don't think any athlete would have been aware that, I'm sure they would have seen all this happening in their body, but they wouldn't relate it to the sport. Sweating, is considered a natural coolant and a detoxifier, but if not taken care, it's amazing how much of discomfort it can give rise to. Doctor, how can an athlete take care of these infections if they do get?
Yes. So since for an athlete it requires long hours of practice, and especially if they are in professional athletes, they have to follow simple steps. First thing is avoid makeup, which I'm sure most don't do. Use a proper sunscreen, a sunscreen that suits their skin, preferably a non-comedogenic, that is which doesn't predispose them to get acne. They should use a sunscreen and reapply it if required. And immediately after their session, rinse off the sweat. That's very important. So that prevents them from any sort of sweat-induced problems. and wear the appropriate clothing, because you don't want clothing that keeps the sweat in the skin for a long time. So there are a lot of newer sportswear which removes the sweat quickly, and the footwear, that they have to wear appropriate sized footwear. The socks should be clean, washed regularly, so that it can prevent them from infections, and air out their feet. If they have long hours of sessions, remove the socks and shoes and air out their feet. And yeah, these are the simple steps that they can follow. One important thing is they should use a antiperspirant. A deodorant is good. It will improve the smell. I mean, it will reduce the smell, but antiperspirant will block the sweat secretion, so that way they will feel a little more comfortable.
So doctor, like you rightly mentioned, about the socks and all that, because definitely the feet also gets wet, and then there's a lot of sweating that happens. Is there some kind of a treatment that the athletes can take to I wouldn't say avoid sweating, because it's like we said, it's good to sweat,
yes.
But maybe curtail the amount of sweat that they can do, or aesthetically, is there something that they can take advantage of?
So yes, see, sweating is something important. As you said, it helps to regulate the temperature of the body and all that. But when some people have excess sweating normally, even without doing any activities, and for such individuals, if they are into sports, it can be very difficult for them. For some of them, we do Botox in the underarms. So we dilute the Botox and give it. That reduces the sweat secretion, and they can feel a little more comfortable. Another thing, commonly athletes come, when you said aesthetic treatments, come is for laser hair removal, because they need to wear shorts or sleeveless, those kind of costumes, and shaving or waxing for them can be a little tedious every single time. So they opt for laser hair reduction quite frequently with us.
Doctor, you mentioned shaving, so I'm sure shaving regularly, because like you rightly said, they have to be in their sportswear, which is mostly shorts or what they call sleeves,
yes.
Sleeveless vests or whatever they wear. Shaving can also add to the irritation of the skin, doctor. So
yes.
Laser hair reduction would be an apt choice for them?
It would definitely be a good choice for especially those in the sports field, because when you use a razor, you will be using it once in 2 days, once in 3 days, and depending on how fast their hair grows, and repeated friction on the skin is not good. It will dry up the skin. It can cause something called as frictional pigmentation. The skin can look more pigmented. So already they are prone to more insults on the skin. So further, we don't have to, insult our skin. So they can go for a laser hair reduction.
So doctor, these infections that you mentioned, I think most of it is an outcome of their exposure to either the sun or to the dust or pollution around them. But can these infections be contagious? Do they go skin to skin?
So yes, if it is a fungal infection, then contact with clothes or sharing of the towels, all these can pass on the infection. If it's a viral also, it can pass on, like I said, interchanging of footwear or things like that, or even sometimes in the washroom when they walk bare, they're already sweating and the skin is macerated. When they walk barefoot, then they're likely to get the warts.
So doctor, the sports people normally, like you said, they sweat out, and they are, they during their training they have excessive sweat, or their feet is wet. They generally tend to relax after their training or whatever, and they don't change out of their sweat. So how important is it for them to get out of that wet clothes and get into a dry clothes faster?
Extremely important, because one is they have to rinse off the sweat that is already there in the body. Wherever they are, at least they should carry some water with them and wash off the face and at least the neck part, and they must remove those clothes, change into dry clothes. So they commonly we see them with something called as pityriasis versicolor. In Tamil they say thembal, no?
Mm-hmm.
That's also a fungal infection actually. It won't disturb them, but you'll have a lot of patches of white patches. Sometimes it can be dark patches as well. So to avoid all that, they should get into dry clothes as soon as possible.
So doctor, when should an athlete come and visit a dermatologist? Because like you said, let's say there are rashes on the body, I could just dismiss it saying that it is, just a prickly heat, or maybe a reaction to a particular, type of fabric that I'm wearing. So what is the symptom that they need to look for, and when should they see a doctor?
See, anything abnormal on the skin, they have to come and see us. If there is itching, if there's persistent patches that won't go away with either home remedies or just by leaving it, if it hasn't gone away with more than a week, and if it's itchy, if it's irritated, any symptoms, anything abnormal, they have to come to a dermatologist only. And they can come, they must come, they can come if they just want a proper skincare routine for them, what moisturizer to use, what sunscreen to use, or depending on their routines, we can suggest some good skincare tips.
Doctor, it's amazing as well as unfortunate to note that while athletes, irrespective of which sport they are in, they take tremendous care about their muscle, about the bones, but seldom do they give any importance to the skin. And skin is the most important part of their body, because it's a protective layer.
Yes.
So why should a sportsman sacrifice their skin?
Correct.
So what would be your advice or your message to all the sports people out there? What would you like to tell them about their skincare?
The thing that actually troubles them is the sweating part. So the rinsing is extremely important post their workout or their sessions, and changing into dry clothes, wearing dry socks and well-fitting shoes, and sunscreen.
Always, no doctor, prevention is always better than cure.
True.
So Dr. Shraddha has shared with us very, very simple tips as always, things that can be followed. So athletes, don't ignore your skin, keep your skin happy and healthy, and all the very best to you, and here's to a lot more winning. Thank you so much, doctor.
Thank you.